On weekends, I do what I don't do during the week. I take a look at what was the headlines for our local news. And this week, apparently, there was a tragedy whereby a 1 year old kid allegedly choked by taking, or having been given rather, a half of a tablet of a deworming medication. In fact, the father says that the mother gave less than half. So perhaps one third, perhaps a quarter tablet. But is it for a 1 year old child to be taking tablets? There are some medications that come in tablet forms that they dissolve in the mouth if you give it to them. I'm not aware if this specific medication was in a form that if you would take the full or half a tablet or a portion of the tablet, it would dissolve in one's mouth. So most tablets, if you put them within the mouth, the saliva of the mouth, it's not enough to dissolve the tablet. It would have to be dissolved once within the region of the stomach, the lining of the stomach. And that would be assisted by the juices in the stomach that help for digestion. So apparently this child, or allegedly this child, was given this tablet on an instruction on the instruction of a healthcare professional. I'm not sure if it was a doctor or a nurse that gave this indication, what health institution. And so choking is not something normal. It is something that is you want to avoid, because any foreign object within the airways that you choke on can result in a person having serious damage to the airways, or to the brain due to a lack of oxygenation, not enough oxygen supply reaching the brain, and it can cause death. So I don't have the details, and of course, the authorities are the ones that have to determine what happened. But a couple of pointers that we must point out. I'm also a doctor, not a pediatrician, and of course, hats off to pediatricians because they're the experts when it comes to determining the proper dosages for minors who cannot take pills, and even the proper dosages for medications that come in a solution form. But any one of us who has had training at a medical school, we do have to do our rounds, or we have to do a clinic within the pediatric department whereby the pediatricians, the professors, teach us how to calculate the dosages of medications so we would know how much to prescribe to our patients, our small patients who are pediatric patients, kids. Pediatricians as a specialist are people that do this every single day, and they can do this with their eyes closed like the back of their hands. Those of us who don't see kids as much on a regular basis for cough and cold and loose stools and abdominal pain, etc., well, we got to take out our calculator and we got to make sure that we know according to the child's weight how much milligrams are going to be given according to kilograms, and how many times a day it's going to be fractioned and for how many days. Personally, I don't prescribe tablets to kids. If you have a child who's 1 year of age, can you expect that a child at that age would have enough maturity to be able to swallow a tablet? My humble opinion is no, because the swallowing reflex, which is called deglutition or also called inglutition, is a 4-step process, and I'll explain it in a few. It's a 4-step process of which only the first step of the process is voluntary. But for a child to have any semblance or of control of what would be seemingly good control to swallow, most times it is said that that child would have to have about 18 months of age. That's about a year and a half. My take on it, and of course I stand corrected by any pediatrician that knows more than I do, is that kids, while they're growing at 2, 4, 6, 8 years of age, I personally don't prescribe tablets for them. So I feel comfortable doing that in a kid who is normal, and perhaps at 10 years of age, I feel that they can take medication in a tablet form or portions of a tablet. But if I'm going to prescribe and I don't have another option because perhaps the pharmacy or the dispensary does not have the medication in a solution or a syrup form, and a drinkable form that is in liquid, then there are times that you have to prescribe it as a tablet. But there, obviously, there are two things you can do. If the person has the capability of getting this transformed into a liquid form. There are some pharmacies whereby we do have pharmacists who can compound, which is that they take something in a solid form like a tablet and they can transform it into a syrup presentation, whereby an oral solution whereby the kid can take it. That's a service that's available, and not in all pharmacies. I don't know at the government level how much this is offered. That would be for somebody within that realm to shed some light on it. But also, if you have a kid that you have to give a medication in a tablet form because you don't have it in an oral solution form or a syrup form, then perhaps what you need to do is you need to pulverize, which means you need to break that tablet out up into powder, so you can perhaps mix it with water or some other component, some other liquid components that it can be drinkable. I mean, even though we know that the taste most times is not the nicest taste. So with this, I'm not going to give any theories on what the possibility was with the passing of this child. That, like I said before, would need to be the authorities who would give their input on it, whether treating professionals who took care of this child, or if by law it is necessary or has been necessary for that child to have an autopsy done. I don't have all the information, so I can't give anything much more of an opinion in that sense. However, like I said before, swallowing, just to shed a bit of light on this topic, is something that personally I feel we should not be overconfident and think that a child 1 year of age can swallow anything on their own. That is not so. Minimum data is going to tell you that 18 months is when that swallowing reflex starts to be more commonplace. But that doesn't mean it is normal. So my experience is I would prefer a child who is 10 years of age and above perhaps can take medications in a tablet form. And I mean a solid tablet form. Or outside of that, I would suggest pulverizing, in other words, making into a powder form and mixing with a little bit of liquid that has been given as a tablet for you to give that child drink to minimize the possibility of choking. So swallowing is a 4-step process. The first part of the process is that when you put the food in your mouth, whatever you're going to swallow, that first part is voluntary, is whereby the middle to anterior part of the tongue, you, on a voluntary basis, because you're aware if you're chewing something, you go preparing what is called the food bolus, and that is voluntary. The second part of the process, it's called the transition process, is when it's at the back of the tongue, and then there it no longer is voluntary. It is taken over by the local tissues inside the mouth. So the mucus in the mouth, and of course the muscles within the mouth, which they all connect to nerves that are born inside the brain. And well, this part of the body is very close to where the brain is. So that's step 2 to the back, which is called the transition process, is whereby the soft palate, so we have the hard palate in the front, the bone that's here in the roof of my mouth, and right behind we have the soft palate, and the soft palate rises to block off the communication it has with the nose at the back. And then that food bolus is going to go downward, but before that happens, what is called the larynx, within the space of the larynx, which refers to the part where primarily air is going to pass through. We have a little structure, like a little flap, like a little lid, that's called the epiglottis, that's going to cover the glottis, and the glottis is the opening to the windpipe, the trachea that we have in front here. And so when that food is going to go down, the epiglottis is going to cover the glottis. And in a small child who is approximately 1 year of age, that glottis is not more than 5 millimeters, not 1 centimeter, half a centimeter or 5 millimeters on average. It's not a very big opening, but it is an opening that is important, because if it's blocked inappropriately, it can cause demise or can cause serious neurological injury, among other injuries that are there. So the epiglottis is going to cover the glottis, and that allows the muscle that opens up where the esophagus is, which is the food pipe at the back behind my windpipe, to allow the bolus of food to go downward. So the first part of the process, like I said, is the oral preparatory process. That's voluntary. The second part is transition. That's involuntary, to the back of the throat. Then it passes into the pharynx, or the pharyngeal region, like I said before, and there, that's the third part of the process where the muscles in the pharynx or the pharyngeal region are going to push that food bolus downwards towards the esophagus, and at the same time, the epiglottis covering the glottis. And then the fourth part of the process is that we have a little muscle like a trapdoor also that opens up where we have the food pipe, the esophagus. It allows the food to pass in there, and afterwards the food is going to move down what's called peristalsis, like a snake-like, worm-like type of movement whereby the muscles are contracting and relaxing, allowing that food to go down towards the stomach. So that esophageal component is step 4 in the process. If you notice, you cannot swallow and breathe at the same time, because breathing has to do with the airways, the larynx, and swallowing has to do with the esophagus and the pharynx. So it's not the same thing. Now, small kids do have something that is called gagging, babies, right? And that's a natural reflex. It's actually called a defense mechanism. And that is that mechanism, anything that's in the mouth that is threatening to be close to the airway, gagging is whereby solid things are going to be brought towards the front of the mouth. That is called gagging. When that happens, the kids are making a noise. Usually, if they're fair-skinned kids, they kind of get red in their face, and they might stick out their tongue. And this we find a lot in kids when they first start to eat. They're exploring solid foods in their mouth. Now, choking is not normal. Choking is a medical emergency when a food or an object is stuck in the airway and then air cannot pass in and out. That is choking. While gagging might have a component of coughing in it or making noise, many times choking is silent, or at most, because that object or food is covering the windpipe, the passage of air, there might be a small squeaky sound that's called stridor or stritter. And when this is happening, these babies are not calm. They are very panicked or terrified. That's the look they're going to have in their eyes, and most times they're going to look at you because they're looking for help. But at times, choking can be silent. So if you have a kid, you cannot leave a kid with something in their mouth and run to do something, within your home. Check the stove, take a shower. If a kid is eating, you got to be there on the spot, because they can choke silently. You come back and they're not with you anymore. They're unconscious, or they could pass away. So if you have a child that you think is choking, of course, it's always best that you know the basics in CPR, what you must do, because just the simple pathing that, our grandmothers would do, or many people still do, most times worsens the situation and does not help when a child is choking on food or something of the like. Putting your fingers in a child's mouth when they're choking might not be the best thing, unless that object or food is right in the front, which most times it is not. Because choking, you have the danger that perhaps you can push that object towards the back. What's the best position for eating for a kid? Supported seating. So they're sitting down, preferably in the chair you have for a kid. They're strapped in. There's support to the back region. And of course, they have the top of their table where they're learning, exploring to eat what they have to eat. And the best thing is that you, the adult, the responsible adult, not a kid, be sitting and watching them while they are eating. There are certain foods that we must take into consideration that are not appropriate for you to give a kid. For example, grapes. That oval shape of a grape is ideal to cause choking, to block the airway. And even if you cut that grape in half, the fact that it has an oval shape, and perhaps one half of it may have an oval shape, if you give that to a kid, they can choke on it, and it can get lodged in the airway, the glottis, and that would be a terrible thing. But there are other things that can cause this, like you don't give a kid popcorn, you don't give them dry nuts, and around the home, little things can cause a child to choke: marbles, sweets, coins, hair clips, buttons. So if you're going to give grapes, the best thing is to take that grape and to cut it in 3 longitudinally, lengthways if you want to say, so that it's in the shape perhaps like a little strip, like my finger, like a baton. And the same thing if you're cutting things like sausages to give your kids. Don't give them in an oval form as though it were a coin, like a 25 cent. No, because they can end up choking on it. There are specific procedures that are done from the CPR perspective when a child is choking, and these are called back blows, which is done between the bone at the back called the wing bone, the scapulae, and also in the front on the breastbone, the bone here that is between the chest. And for that, you have to have some basic training to know what that is like. It is unfortunate to have heard this news, because I do remember in my experience in times past, I remember a specific couple that their only child apparently was with a caretaker, and that child choked on something while being under the care of the caretaker, and the couple, they were at work. And you get called in just to give an opinion, and what's the state of the child, and having to declare, listen, there are no reflexes that this child is alive. This child is alive because the hospital has the child on a life support machine, which is making just the heart pump and forcing this child to breathe, but the brain has basically disconnected. So death is imminent. It cannot be avoided. If we were a country at that point that it could be offered, the organs could be offered up for donation. At that time, we didn't have a transplant surgeon as we now have in our country, and that wasn't an option. But what hurt me to see was the pain, that pain that I could not relieve of those parents having to tell them that their baby was brain dead, firstly, and secondly, that their child was going to pass away. And they were in denial for about 2 or 3 days, whereby the hospital kept that child on life support until other family members came in from abroad to have a final look at the baby being alive. And then the baby was disconnected from the machine because life was impossible. And those are things that as a healthcare professional, they are with you every single day. And this is just a small message that hopefully we can avoid another kid having such an unfortunate situation like this one that happened recently. For whatever reason, this child passed away. But remember, when we are swallowing, we cannot speak. If we try to speak when we're swallowing, we're going to choke, and it can cost us our life, or for us to have certain issues whereby if within a couple of seconds, like between 3 to 5 seconds, oxygen supply is cut off, the lung being able to provide to the circulation in the body oxygen supply, it's going to have damage to the brain and other tissues in the body, and that damage can be permanent brain damage. So just remember, we cannot swallow and speak at the same time.